So, what exercises are good for your neck in case you're hurting in your neck? It's a very difficult question to answer because, like I said before, many of these ailments depends on your posture. And when you come here to Patterson Physical Therapy, we're going to look at your posture and decide what type of specific exercises you need. But there are some principles, so we can find a consensus on general exercises for the neck. One of the principles is that you need to run away from the pain. For example, if you're hurting on your left side of your neck with or without radiculopathy, the principle is to stretch away from the pain. Always, like we said before, do it in good posture. So remembering that picking up the chest puts things in the right position to heal, so you keep that chest up to a range of comfort. If you're hurting on your left side and you feel tension, tightness, or even radiculopathy, you want to stretch in side bend away from the pain. So, stretch away from the pain. For any stretches, generally speaking, they need to last minimum of 15 seconds. And that's the minimum time without any length of time as long as you can tolerate it, but the minimum for a stretch to be effective should be 15 seconds. Always leave the stretches at the end of your routine program of exercises or after a hot shower, so do not stretch too cold in general. So principle is to stretch away from the pain, and after you have stretched in side bend, you should rotate the head also away from the pain. If you want to make the stretch more efficient with the opposite hand, you can grab your upper trap and let the weight of your arm pull. So that feels really good, but don't get too cozy. Don't lose your posture. So no slouching is another principle. I tell my patients, never slouch in front of your therapist. Alright. Another principle, we already talked about taking a 20-minute nap that restores the height of the disc, that decompresses the facet joints and decompresses the nerve roots. But for the neck, it's, like I say, hard to make something specific because it all depends on your specific posture. But what I tell my patients is when they have neck pain and it's time to take that nap, you should make a roll out of a sheet. I'm not good at folding the things, but you try to square it up as best as you can, and then you are going to create your own neck roll or cervical roll that needs to be customized to the shape of your neck. When you find the roll that perfectly fits your neck, guess what? Cut it and tape it. You're going to sacrifice one of these, but it's cheaper than spinal surgery. So when you make your own roll, and you should try several sizes, I'm here just eyeballing, estimating. I think that will be good for me. I'm gonna put it there to take my 20 minutes nap. I actually do that here at work. I told my boss that sometimes after lunch I'll take a 20 minutes nap, so they know about it, so they don't get mad at me. It's not to sleep, it's just to take a short nap, so I could be more productive working the rest of my day with less pain. That actually improves productivity. So, by the way, your neck, when you come here and we look at your posture, you might have a flat neck. People have flat necks. Those flat necks have disengaged the facet joints, and they put all the pressure in the disc, and they're more prone to have radiculopathy, pain from the neck radiating to the upper extremity at some specific levels, On the other hand, you can have an excessive curvature of the neck. We call that hyperlordosis. Usually those people have engaged the back joints of the spine too much, those facet joints, they get irritated, and generally speaking, they develop neck pain and tension, but usually not radiation to the upper extremity. regardless on how the neck is, this is good because this is gonna maintain a normal curvature of the spine. If you have a flat neck, it's gonna increase the curvature, that's good. But if you have a neck with excessive curvature, having the proper roll will depress the curvature to what is normal, and that normal is comfortable to you, to the specific person, you know. So before you decide which one is the best width of the roll that you need to try several heights, and along with your physical therapy you can take the best decision. So I'm gonna lie down now and I'm gonna put it in the base of my neck. And that already feels good to me. Maybe this is a little bit thick for me, should be a little bit less. But I feel now like my neck is in the right position to heal. With that in mind, I'm gonna take my 20 minutes nap. I could read a book, I can listen to the news, but right now I'm decompressing my entire spine from the neck to the sacrum, and that actually feels good. Now also, I would like to explain that the neck needs to be stable. Sometimes we develop instabilities in the spines. Most of the times we do when you have pain, because the neck will guard and the muscle will tighten to protect you from that pain. But over time they lose strength, they weaken, you know. And regardless of your condition, usually when the pain has decreased, the focus of a physical therapy treatment will be in stabilizing the neck. Again, when we stabilize the neck, we'll do it in the proper posture. Remember that the chest up puts things in the right position to heal. But if you have forward head posture, you should have some measure of chin tuck, you know. Do not exaggerate it, gentle, you know. And to strengthen the neck, while you maintain the proper posture, you're gonna match your own force with a diagonal approach, nice and gentle. Do not do this if you're hurting. This for the times when your pain has gone away for a few days. So you apply yourself a gentle force to your neck through the head, matching your own force. If this exercise gives you pain, you should stop it immediately and consult with your physical therapist or your doctor. Another way to stabilize the neck while you're taking that nap, you can one more time get on the cervical roll. You're taking that nap time, and once you have position and you're in comfort, you're going to do some gentle chin tucks. As you're doing gentle chin tucks, you're doing a co-contraction. You're activating the back part of your neck. There's some specific muscle at each level of the spine there called the multifidi. And you're strengthening the front of the neck because you're activating a deep muscle deep in the neck that is called the longus colli. So your neck will end up stronger. But this must be done with the neck with the proper curvature in the proper position to heal. So that's with the neck for now.